If you or someone you love takes amlodipine for blood pressure, stick with me for the next several minutes because there are 5 everyday things that can quietly change how well this medication works for you. And most people never hear about them from a rushed 10-minute doctor's visit. I'm Dr. William Lee, and I've spent years helping patients manage heart health safely, especially as they get into their 60s, 70s, and beyond, when blood pressure medications become such a common part of daily life. Today we're talking about amlodipine, sold under names like Norvasc, one of the most commonly prescribed blood pressure medications in the entire country. Chances are, if you're watching this, you or someone in your family takes it every single day. Before we go further, let's be clear about something important. Amlodipine is a well-studied, generally safe medication that has been used by millions of people for decades. Nothing in this video should make you afraid of your prescription or make you want to stop taking it on your own. What this video is about is helping you understand a few practical, well-documented things that can affect how this medication behaves in your body. The kind of details that often get skipped over in a busy pharmacy pickup or a 15-minute checkup. So let's start with number 1. And this is one people are genuinely surprised by: grapefruit. Grapefruit and grapefruit juice contain compounds that can interfere with an enzyme in your gut and liver that normally helps break down certain medications, including many calcium channel blockers like amlodipine. When that breakdown process is slowed down, more of the medication can end up circulating in your bloodstream than your doctor intended, which can increase the blood pressure lowering effect and, in some cases, side effects like dizziness. This is a well-documented interaction described in pharmacology literature for years. Not everyone reacts the same way, and not every formulation is affected equally. So this is exactly the kind of question your pharmacist can answer in about 30 seconds the next time you pick up a refill. It costs nothing to ask. Interestingly, this interaction has been studied enough that it's now printed on many patient information sheets, though a lot of people skim right past that fine print. If you've been enjoying grapefruit at breakfast for years without any noticeable effect, that doesn't necessarily mean it's not doing anything. Some effects are subtle and only show up in blood tests, not in how you feel day to day. That's exactly why this is a conversation worth having, rather than something to just guess about. Number 2 on our list is swelling, particularly in the ankles, feet, or lower legs. This is one of the most recognized side effects of amlodipine and other drugs in its class. And it happens because of how these medications relax and widen blood vessels. That relaxation is exactly what helps lower blood pressure, but it can also allow a small amount of fluid to shift into surrounding tissue, especially in the lower body where gravity pulls fluid downward over the course of a day. For most people, this swelling is mild and more of a nuisance than a danger. But if you notice it happening for the first time, or if it seems to be getting worse week over week, that is absolutely worth mentioning at your next appointment, because there are simple adjustments that can often help. Some people find that elevating their legs in the evening, wearing compression socks, or simply moving around more during the day helps reduce this kind of swelling. Others find that a lower dose, or switching to a different medication in the same family, resolves it almost completely. The point isn't to diagnose yourself from a YouTube video, it's to know that this symptom has a name, a known cause, and real solutions, so you walk into your next appointment ready to ask the right question, instead of just quietly worrying about it. Here's something a lot of people don't expect, and this is number 3. Combining amlodipine with certain other blood pressure medications, or even some medications for completely unrelated conditions, can sometimes cause blood pressure to drop lower than intended. When that happens, the most common symptom people notice is lightheadedness, especially when standing up quickly from sitting or lying down. Doctors sometimes call this orthostatic hypotension, and it happens because your blood vessels need a moment to adjust to the change in position. If you've ever stood up and felt the room tilt for a second or two, that's not something to panic about, but it is something worth bringing up, particularly if it's happening more often than it used to, or if you've recently started a new medication alongside your amlodipine. This becomes especially important for older adults, since falls related to dizziness are one of the more preventable causes of injury at home. A simple habit that many doctors recommend is pausing for a moment after standing up, resting a hand on a counter or chair back for a few seconds before walking, which gives your circulation time to catch up. It sounds almost too simple to matter, but it's one of those small habits that genuinely reduces risk. Moving on to number 4, timing and consistency. Blood pressure medications like amlodipine work best when they're taken at roughly the same time every day because that helps maintain a steady, predictable level of the medication in your bloodstream. Missing a dose here and there, or occasionally doubling up to make up for a missed one, can lead to blood pressure swings that undo some of the steady control this medication is designed to provide. It's a simple thing, but it makes a real difference over weeks and months. A daily pill organizer, a phone alarm, or even just tying it to an existing habit like brushing your teeth can make a surprising difference in how consistently people take medications like this one. Small systems tend to beat willpower alone, especially over the long run. This matters even more for anyone managing several prescriptions at once, which describes a lot of people over 60. When you're juggling 4, 5, or 6 different medications with different schedules, it becomes very easy for one dose here or there to slip through the cracks without you even noticing. If that sounds familiar, a weekly pill organizer with morning and evening compartments is one of the simplest tools available, and pharmacies often sell them for just a few dollars. And now, number 5, which might be the single most important point in this entire video. Never stop taking amlodipine suddenly on your own, even if you're feeling fine. Even if you've read something online that worried you, and even if you think your blood pressure has been well controlled for a while. Stopping a blood pressure medication abruptly can sometimes cause blood pressure to rebound and spike higher than it was before you started treatment. Any changes to your dose or any decision to stop this medication should always go through a conversation with your doctor first. If cost, side effects, or anything else is making you consider stopping, that's a completely valid concern, but the right next step is a phone call or appointment with your prescriber, not simply skipping doses on your own. There are almost always alternatives or adjustments available. I understand why people sometimes consider stopping on their own. Maybe the copay went up, maybe a friend mentioned a scary story they read somewhere, maybe you simply feel fine and figure the medication has done its job. But blood pressure medications like amlodipine are usually managing an ongoing condition, not curing it outright, which means the steady control you're feeling is often because of the medication, not despite it. That distinction matters, and it's exactly the kind of thing worth a 5-minute phone call to your doctor's office rather than a decision made alone at home. So to recap where we've been, grapefruit and its effect on how your body processes the medication, swelling as a known and usually manageable side effect, the possibility of low blood pressure symptoms when combined with other medications, the importance of consistent daily timing, and the real risk of stopping this medication abruptly without medical guidance. None of this is meant to alarm you. It's meant to help you get the most benefit from your treatment while staying alert to a handful of things that are genuinely worth a conversation with your care team, rather than something to search for and worry about alone at 2 in the morning. If you're taking amlodipine, I'd love to hear from you in the comments below. Have you noticed any of these 5 things yourself? Or has a pharmacist or doctor ever mentioned one of them to you directly? Your experience in the comments might be exactly what helps someone else watching right now who has the very same question but hasn't asked it yet. And if you found this video helpful, consider sharing it with a parent, spouse, or friend who's also managing blood pressure with medication. Sometimes the most useful health information is the kind we pass along to someone we care about, rather than the kind we stumble across on our own. I also want to say this clearly, because it matters more than almost anything else in this video. Managing blood pressure well is one of the most protective things you can do for your long-term health, reducing risk for issues affecting the heart, kidneys, and brain over time. A medication like amlodipine, taken consistently and understood well, is a tool that helps you stay independent and active for longer, not something to fear. If you have questions about anything we covered today, or if there's a related topic you'd like me to cover in a future video, whether it's another common blood pressure medication, questions about diet and salt intake, or how to talk to your doctor about adjusting a prescription, let me know in the comments. I read through them, and your questions genuinely shape what we cover next. As always, nothing in this video replaces a real conversation with your own doctor or pharmacist, who knows your full medical history and can give you guidance specific to you. If something here raised a question for you, write it down and bring it to your next appointment. That's exactly what this information is for. Stay safe, Stay informed, and I'll see you in the next video.